Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Joseph Narvaez. He's an AVP Business Intelligence, Office of Patient and Customer Experience at Northwell Health. And Juan Contreras, he's Director of Patient Experience at North Shore University Hospital and Northwell Health. Welcome, guys.
Thank you. Thanks for having us.
Happy to be here.
Yeah, excited for this discussion. You guys are doing some really innovative things, making amazing patient experiences for the patients that come to your organization. But before we go there, Joseph, why don't you start us off? Tell us a little bit about yourself and Northwell Health.
Sure. So as you mentioned, I head up business intelligence within patient experience at Northwell Health. However, at times it also takes me, one of the luxuries of being over that area of focus is that we capture so much patient feedback on the regular basis that is invaluable. That's an invaluable VOC, if you will, voice of the customer, to use as the foundational element for building out requirements for digital solutions and workflows such as the one we're going to talk about today. Northwell Health is a large integrated health system based out of New York. We have over 20 hospitals, soon to be growing, and over 1,000 ambulatory locations soon to be. And that spans from the far east end of Long Island into Manhattan, down to Staten Island, and up through Westchester County and Connecticut, soon to be the Hudson Valley as well. So we do a lot of great work. We have a great culture, and we really engaged and went into this effort looking to see how we could leverage technology to really enhance that culture of care that we already do so well in Northwell Health.
Love it. Juan, how about yourself?
Sure. So as the Director of Patient Experience at North Shore University Hospital, which is the flagship hospital at Northwell, really focus on improving the patient and customer experience, really targeting connectedness and making sure that everything is aligned with our culture of care. We really do ultimately want to impact the patient experience, but so much of that also, it really piggybacks off of the team member experience as well. And so we look at it from that unique lens and partner with Joseph and our folks from our Office of Patient and Customer Experience to really target that experience and ensure that the voice of the customer continues to improve.
That's awesome. Well, let's talk about that, Joseph. What are some of the core tenets you have in your patient, but also, as you mentioned, the employee experience efforts as well?
Well, I mean, really all sorts of, Juan just mentioned our culture of care. So every new team member that comes into the organization from day one, they are educated and made comfortable with the way we approach that said culture of care. CARE is actually an acronym. It stands for connectiveness, awareness, respect, and empathy. So what does that mean? It means connectedness. How are we connected with the patients? How are we empowering the patients to connect with their families, their caregivers, those that they care about and support them? And then we talk about awareness. A big thing in healthcare is there's a lot of information flying around. It can be a very complicated and challenging environment to navigate. So how are we putting the right information, the relevant information in front of the patients and those that are caring for them in a way that is easy for them to consume and act on? We want patients to focus on being patients and being better, and caregivers to focus on taking care of their loved ones, not trying to figure out the logistics of how to navigate a complex healthcare delivery system. And then respect, it comes down to respect. Well, the way we look at respect is, yes, it's about being respectful when you're engaging with someone, but it's also about how our processes are respectful of people. Are we honoring their preferences, right? Are we honoring their preferred language? Are we honoring when they like to be engaged, when they don't like to engage, conveniences? And then empathy is really what it comes down to. Like, there is a way for technology to be empathetic in nature, and that's what we're really trying to do. You can have technology that is integrated and deployed in a manner that is empathetic to the patients. And that's the number one thing. It's how can we put ourselves, our team members, in our patient's shoes to understand what they're going through in that moment, but also how can we design our digital experiences such that from the patient and caregiver's perspective, they feel that the process or the transaction that they're going through or the journey they're going through is actually empathetic of what they're going through in that point in time.
Interesting. I love that idea that technology can provide an empathetic experience. That's a powerful idea. I learned that you decided to implement a smart TV and digital whiteboard solution, from eVideon, the Vibe solution. Talk to us about, why did you decide to implement that for your patients?
Well, so this work started quite a while ago, well before COVID, actually.
Okay.
And COVID obviously derailed our efforts for a little while, but we jumped right back. If anything, COVID actually exacerbated and highlighted the need to actually deploy this type of technology to give more control and empowerment to the patients and anyone who's in the room going through that journey with them. But the core tenets was really, how do we make it easier, right? How do we remove the friction that a patient experiences on the day-to-day, whether we started in the inpatient environment, so that's what we'll primarily be talking about today.
Sure.
But this is very easily expandable out to the ambulatory and outpatient care environment as well. But that really was our core tenet, was how do we make it easy? How do we empower patients? How do we get the relevant information to them? And really give them control of their lives a little bit more. Like, there are some things that a patient loses complete control of their day-to-day when they're in the hospital. So what can we give them control of? So something as simple as being able to order your meals out in advance, right? Being able to know who's been in your room, how long they were in their room, and understanding where you've been, where you are, and where you might be going in terms of your care journey. So those are really that was the impetus. At least those are the core tenets and ideas that we wanted to kind of be able to deliver to the patient and family on this journey. I don't know if Juan, if you wanted to add any to that from a site-specific level.
Sure. I think that at North Shore, we also wanted to make sure that being a quaternary hospital, seeing patients in every aspect of the continuum of care, really wanted to make sure that we fostered a connection and that we allowed our team members to be effective and efficient in delivering the care. When you aspire to such a high quality care delivery methodology, it can sometimes be challenging to find the time to do the most important thing, which is connect with the patient. And so we wanted something that could really help us be able to find that time, but also put us on the path if we do get lost from connecting with that patient. How can we bring it back, right? How can we understand the voice of the customer and really connect with the patient? And that's how we brought it.
Interesting. So what were some of the design considerations that you thought were key to making sure that the smart room technologies were a success, and to your point, helped your employees and provided a better experience for the patient?
It's a lot of what you just said. It needs to be smart on the preface of how is it supporting our team members in delivering that care, not just being smart because it collects and has access to a ton of information. If it's not relevant and it's not being useful in streamlining the patient experience or the team member experience, then what value does it truly have? So leveraging the connectivity to ensure that we could actually target the patient's experience and target how the patient feels about the delivery of their care was really at the core of that.
Yeah, and I would add to that, really, we went into this laser focus on the idea that let's identify the workflows, the micro transactions, the engagements that are really non-value added to either the staff or the patient and care team in some instances. Case in point, meal ordering. Right now, before this, we had teams that would try to take meal orders, but if the patient was at an appointment or they were at rehab or they were on a different floor for a CT scan, couldn't get that order. And then there's one person that's doing this, so you run the risk of maybe not capturing that patient's order. So is there value added? So what we try to do is we try to remove those non-value added activities. So give the power to the patient to order their own meals. Another good example is the whiteboard or service calls. Okay. How could we design the infrastructure such that we empower the patient to ask for what they want when they need it? And then we also, from a whiteboard perspective, we wanted to give the relevant information on there that was really driven behind the scenes and not really dependent on a nurse to go in there and say, hey, just a quick update. this is what's going on next. There's a CT head scan coming up. That could all be done behind the scenes. And then one last example that I like to use is the automated assignment of patient education.
Oh,
right? So nurses are super busy. So instead of having them go and do their documentation and then also as a secondary workflow have to go in manually and assign education, there should be an intelligent integration involved in here where they just focus on whatever documentation they're doing, and then the system's intelligent enough to dynamically assign patient education based on the documentation that's in place. So just
that's awesome.
Things we were looking at.
Well, it's interesting. You talked about meal ordering and integrating that, so it's a great experience for the patient, and then you don't miss the patient. I love that. Talk to me about some of your other integrations. Are you doing the EMR, RTLS? Are there other systems that you're using to integrate with the smart room technologies? Maybe you could start.
I think RTLS is a great example, but for that, I'll actually hand off to Juan for that, because he's been really intimately involved working with nursing and the physician leadership at the site to make that kind of workflow implementation a success.
Yeah. So leveraging RTLS is something that really became core to what were some of the challenges that we were hearing from the patient, not knowing who they were talking to, kind of being overwhelmed from time to time with so much going on outside of their comfort setting. This person just introduced themselves to me, but my mind was, in 10 different places at the same time. It's very nice when, a PA or a doctor walks into the room, we're leveraging RTLS and bringing that up and saying, this is Juan Contreras, your attending physician or your PA, and really helps reduce the anxiety. In healthcare, so much of what the patients are going through really targets the anxiety at the patient, the unknown. So it's really, how were we leveraging the EMR, how were we leveraging RTLS to help reduce the unknown? So leveraging the EMR to really populate the whiteboard to things that matter to the patient, right? And ensure that the whiteboard, it's not just like a repository of information that may or may not be useful. That it's really targeted information. What are my patient goals today? What are my care considerations? What's on the docket for today? What's my meal order? And that connects directly to the meal ordering, right? So that we are aligned and not putting things in front of the patients that could add to the anxiety or the confusion, and really make it more seamless of an experience with a reduction of anxiety. And what we see is that people build trust that way. People are able to trust, I'm in the right care setting with the right people, and I'm having a great experience.
That's awesome. Well, tell us more about that. What's been the impact on patient experience from leveraging these technologies? And are there some stories you've heard? That's, I think, my favorite part. When you implement these, you hear the stories.
Yeah, I think it's important to note that it's been on the patient side, but it's also been on the team member side.
Okay.
But the third party, which is so important to capture, which 50% of the population in the US will eventually become, is a caregiver. So it's also impacting the caregivers as well that come in and support our patients. So on the patient side, getting great feedback. People are informed, people are entertained, people are educated in a very seamless way. We're actually meeting patients' needs. And so every turn when we do our rounding, when we do our targeted questions that we send out to the team, they're telling us, this is effective at making my experience more seamless. And and our team members are also saying, when you have the pulse surveys, that people let us know that there's something that's not meeting their standards, we don't have to wait until it escalates and snowballs into a big problem. We can really target it, nip it in the bud, make sure that we perform that service recovery, that we go in there, and it makes us look integrated. And it helps build the trust with the patient, like, wow, these people really have it together. With the caregiver, this team that's taking care of my family member really are integrated into the care that my loved one needs. And that makes all the difference in the world.
Yeah. I mean, it's nice to go and hear them say that they like the technology. A lot of times we've implemented technology and they're like, why'd you do this to me?
Yeah.
So it's great to hear that you're having a good experience from the employees. Joseph, how would you measure the impact of this technology on the nursing units, the other staff at your organization? I mean, you're the BI guy. How do you measure it?
This is actually a really fun and interesting area for me and my team right now. Traditionally we have the out for the inpatient setting, we have the HCAP survey, which I know a lot of people are familiar with. That's one way, but that really just scratches the surface. You might get some comments on there. Sure. But we've also deployed both the ability to capture passive feedback, meaning like it's feedback that is pushed to us, where we have a tab for feedback, soliciting feedback from either the patient or the caregivers that are in the room, and they can do rating scales on there.
Wow.
They can potentially link to a broader survey down the road, potentially. But really what we've really leaned on is a lot of the qualitative feedback that we're getting on our surveys. We've got some new capabilities that we're starting to deploy where we're really leaning into AI, natural language processing, to really zero in on what are the specific insights or areas of experience that are causing friction, or maybe not, maybe really delivering an elevated experience. And we're really starting to mine that information and use that not just to say, hey, look, this is how we're doing, but to use that as a platform for truly driving product innovation, both internally and in partnership with our vendor partner, eVideon, on this front. And then, oh yes, go ahead.
Yeah, I think that's also part of it. This is we've been on this process this project for a while now. But it's looking at the future. What else can we leverage? How can we leverage information more effectively?
What is next?
In looking at what's next, it's also, can we put that into our pulse surveys for our team members? How is it impacting our team member experience as well, right? Those types of things that we aspire to grow to help manage and evolve the project to more adequately meet our needs as well.
That's awesome. Joseph, what else would you say is next for your efforts, even beyond just this technology, to improve the patient and staff experience?
Great question. I think especially with AI really starting to accelerate, it feels like every other day there's a fancy new technology. Actually, forget technology, I think there's a new vendor every day.
Feels like
with AA technology, but that's a good thing. That means that there's a lot of innovation going on there. There's great ideas coming up, and that can only lead to hopefully some benefit for the PX in the long run. But as far as specifically what we're looking at for our next phase, I think some of the technology that was already mentioned, such as RTLS, and then harkening back to the concept of being able to respect individual preference, and also being able to reconcile what the care team, nursing, physicians want to see on, let's say, a digital whiteboard versus what a patient and caregiver, what might be appropriate for them. Because there were times where there were discussions where there was a bit of, I would say, there was some very animated discussion about what belongs on the digital whiteboard and what doesn't. And what we always tried to center point us back on was the idea that at the end of the day, this whiteboard, this technology is a patient-facing technology that needs to make it easier for them to navigate and understand where they are in their journey. So with that, a lot of times what maybe nursing wanted didn't quite make it onto the whiteboard, but I think with RTLS and AI and the ability to customize, I would love to see a way where we can actually, through context and knowing who is entering the room and what's being done in the room, we could actually on the fly dynamically change what's on that screen. So if a attending physician's in the room or a resident, maybe you're seeing more the care journey, what's been ordered, what might be ordered, what might be the next step, maybe some high-level results of that nature. And then once they're out of the room, then it can revert back to the view of information that's relevant to the patient and the caregiver. So that's one example.
I love it.
And then Gen AI just has so many use cases from a accessibility perspective. When you talk about language translation, educational content creation, potentially in the future, I'd love to see it where if a site has a very niche service or maybe a procedure or diagnoses in which the patient or other individuals need to be educated, potentially you could just prompt the platform to Gen AI an audio video education bit for you, dictate how long does it need to be, hit on these core tenets. But I think that's a lot of potential as well right there. And then just language translation, the ability to leverage Gen AI to not only translate the content that you are passing through the platform, but also the native language within the content, such as menu titles, etc. So I think there's a lot of potential on the horizon for us to take advantage of.
Yeah, I had a little bit of a flashback when Juan and Joseph was talking about some of those animated conversations, like being at the center of those. But I think that with those came a lot of interesting points of view that I think we will be able to more effectively leverage in the future. And so no argument or just back and forth is in vain. I think we can leverage that. One of the things that I would love to see is, unfortunately, we have a large chronically ill population that we serve. So that means we see these patients over a long period of time. How could we leverage the insights from their experience as they continue to come to us for their care? If we build that loyalty and we build that quality experience that we aim for, how can we now leverage the insights that makes our patients think like, why would I ever go somewhere else when this place knows what needs to be known about me, right? And provides me care that's tailored to that. So that's what I think the ultimate future would be, more personalization.
I love that. I mean, that's something really beautiful. If you already know I love HGTV, why isn't it at the top of the list, right?
You know my meal you know my meal preferences. You know that I don't eat beef. Or you know that XYZ. How can we make sure that we leverage that to make your experience more personalized?
And as we integrate across the health system, insights gained from one location can be leveraged at another. So the point you came, like if you log into your let's just call it like your Seamless or Grubhub account, it tells you what you ordered in the past for every restaurant you've ever been to. Why can't that information, that kind of preferential kind of information, be shared enterprise-wide across the platform? So I think we're just scratching the surface. It's a really exciting time. But yeah, we're looking to continue to push this forward and drive as hard as we can to deliver the most differentiated experience that we can for our patients and their families.
Well, Joseph, Juan, I appreciate you coming by to share your experience, your insights and perspectives, implementing this important technology that's changing the experience for your patients and employees. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, guys.
Thanks. Thank you.